So I'm pleased to start this next session, and our first presenter today will be Alisa Brownlee, and she'll be speaking on virtual home modification evaluations for safety and independence.
Hello, my name is Alisa Brownlee. I'm an assistive technology specialist with the ALS Association Greater Philadelphia chapter, and I'm also the assistive technology consultant to the national office. I want to thank you for this opportunity to speak today about the Greater Philadelphia chapter's virtual home modification evaluations for safety and independence. I have no potential conflict of interest in relation to this program or presentation. I have no financial interest regarding any product or software that I'm including in this presentation. I've been doing virtual home assessments for the past 8 months. I'm always willing to schedule an assessment with anybody that would like this particular service. And I will share my slides and email me. My email address is above. I'm a 24-year assistive technology professional, and I've spent 24 years with the Greater Philadelphia chapter and the past 12 years also being the consultant to the national office. In terms of home modifications, I have a certification from the Living in Place Institute and also certification from the National Association of Home Builders. So when it comes to modifying an individual's home, there's many decisions that need to be made. Housing worldwide has not been designed or constructed to accommodate the needs of people with disabilities. Less than 3.5% of current single-family homes have three of the most crucial accessibility features, and those features are zero-step entrances, single-floor living, wide hallways and doors. So when it comes to people with ALS, the questions they ask themselves and they need to ask and work with professionals on is the home accessible? Do they plan on making permanent or temporary adaptations? And are these adaptations safe for not only myself, but to keep your caregiver safe? Can I afford it? The big question in the United States, because the only financial stream that will pay for home modifications is the Veterans Administration. And of course, you have to be a veteran to tap into that benefit. Some states have a Medicare waiver if the client is on the state Medicare system. They may have a waiver that may pay for some home adaptations. Long-term care insurance may offer a stipend for home modifications. That's not true of every long-term care insurance. So you need to check your rider, but a lot of people do not have long-term care insurance. So the out-of-pocket expenses we're talking about can be thousands of dollars. The average cost in the United States to modify a bathroom is $20,000 to $30,000. So that's an exorbitant expense for most people. And so sometimes, most often, it can't be done. The other questions to ask are, will modifications raise the homeowner insurance? Will it increase or decrease my home value? There was a study that said that home values are decreased if you have a wooden ramp out front and you're trying to sell your home. So a lot of people now are using steel and modular ramps, which can be taken away when they're no longer needed. And the question sometimes is, should they move? The psychosocial aspect of modifying a home has to be a consideration by all clinicians and therapists that are working with our clients, because homes are a place of significant meanings. And people view making a home modification as the manifestation of this disease. It's here, it's impacting me. It's impacting my home. I have to change my home because of this disease. And we as clinicians and therapists, we're coming into it from the perspective is trying to keep it safe but also comfortable for you. But we as professionals need to understand that negative outcomes can happen when allied healthcare professionals don't take the client's experience of the home seriously enough, that we don't understand it. And that was actually a peer-reviewed journal study. So we need to understand that the individual's home is a representation of their physical home, the social home, and the personal home. and to understand that and know that modifications aren't something that you walk in, document, and people are going to make the next day. They have to work through various emotions, and cope with the disease, the progression, and the suggestions that are being made. And most people will come around. Some people will not. There are some people who absolutely will not change their home modification, their home at all. They will not make any modifications. And unfortunately, we need to respect that too. So as I mentioned, modifications should focus on safety, and it can be a team effort regarding making recommendations for modifications. So it could be an occupational or a physical therapist, an assistive technology practitioner, aging in place specialist, the chapter or clinic staff. So the most common obstacles that we see with homes are getting in and out of the home and bathroom accessibility. The other issues that we deal with are the width of the doors, the thresholds, stairs, rugs, and maneuvering space. So the virtual home assessment program began as the COVID pandemic lockdown started. So that was late March in the United States. So the referrals come to me from the chapter's social workers, nurses, and the various clinics in our service area. I schedule these assessments using either Zoom, FaceTime, Duo, or WhatsApp or Skype. I want to go with whatever the client is the most comfortable with. Now, since the pandemic, many people have learned how to Zoom, but there are some who just say, I don't know how to do it. I have an Apple phone. Do you? Yes. Then we'll FaceTime. I have an Android. Well, my work phone is an Android, so then we'll do Dual or WhatsApp, whatever they're most comfortable in. This is already a little nerve-wracking for them, and I want them to be in the most comfortable virtual environment. And so I will do whatever they would like me to do. I request that they have as many family members on the call as possible, because we all know that different people hear different things. We begin our discussion with, tell me about your home. Tell me what your areas of concern are. What are your plans? Do you plan to live on the first floor? Or do you absolutely need to go up to the second floor? So then we will do a virtual walkthrough of the home. And I do ask the caregiver or whoever is assisting the person with ALS to have a tape measure so that they can measure the width of the doorways and the width of the hall for me. So my visits are not just about the house. It leads to many other discussions, which include their medical decisions. That's an important question to ask if you're talking about home modifications with our clientele. If somebody says to me that they've made a medical decision and they want to have mechanical ventilation, then of course I'm going to talk to them about permanent modifications as opposed to temporary, which I might discuss with somebody who's halfway or 3/4 of the way through the journey of ALS. And they just need to make modifications to keep them safe and sort of improve their quality of life, but they're not going to want permanent modifications. It leads to topics of caregiving. Who is going to provide my care? Who is going to do that Hoyer lift or assist me in the bathroom? And of course, financing, as I mentioned, this is a huge financial undertaking. What I often advise families to do is make a chart and say, okay, if you had your druthers and you want to make all these home modifications, put it on a chart and estimate how much will that cost. And then on the other side of the chart, put cost of care. Because if you have to hire someone, how much will that be? People don't realize that in the United States, hiring even an aide can start at $20, $30 an hour, and a nurse starting at $50 or more an hour. And that's all out of pocket unless you have long-term care insurance. And one of the questions I will often ask is there a hard limit? And I ask that question to both the person with ALS and their caregiver. And they'll look at me and I say, okay, so there's the person with ALS. Is there something you don't want your caregiver to do? And then I'll ask the caregiver, is there something you absolutely will not do for your loved one? And to be totally honest with you, the answer I get most of the time is I don't want them wiping me on the toilet. Okay. So at that point, that's when you know you either need to hire care or you need to utilize something in the bathroom to take care of that. And that's a bidet. And in the United States, bidets aren't very well known. People look at me and go, what does it do? Outside of the United States, they're well embraced, but here they're not. And of all the products that I do talk about, bidets are the number one device that I get the most feedback on about how wonderful they are. So asking the questions and hoping that the expectations of the caregiver and the person with ALS are the same, but oftentimes they're not. So I address that in our visits. We also talk about external catheter systems for urination, especially at night. There is no need to get up at night when we have external catheters for both male and females. So if we can eliminate a transfer in the middle of the night, we're keeping the person with ALS and their caregiver much safer. So documenting the home assessment, very few occupational therapists report using standardized assessments for their home modification practice. A lot of this is due to the lack of appropriate instruments for home evaluations. In the past, occupational therapists were the primary discipline that did home modifications, but since the aging in place or the living in place movement has taken hold in the United States, where people want to age in place in their home, there are many different certification programs that are training different professionals on how to do home modifications. So it's not just occupational therapists anymore, but still there's not a lot of assessment tools out there for the home assessment. So you have the Cougar home assessment and then an assessment tool called Rebuilding Together. For my inspections or modification visits, I do an app called the Imfuna Home Inspection. And as part of that, I have a template that's been provided to me from the Living in Place Institute since I'm a graduate called the Home Accessibility and Safety Assessment Checklist. And so you can see a couple of screenshots here. It just gives me a checklist so that when I'm on a Zoom call or FaceTime, I'll have my iPad next to me, and it helps me remember what questions to ask and then document that I've asked them. I can develop my own questions within the app, and I could take notes and I can take pictures. So of course I'm physically not in the house, but what I will do is take my cell phone and I'll take a picture of whatever screen I'm on, and then I'll document that in the app so that I have pictures, and then if I have to go back, I do remember, oh yes, that's what your bathroom looked like. So data from the past 8 months since we've been doing this. From April 2020 to November 2020, I did 50 home modification assessments. All these visits were non-veterans. And I say that because the Veterans Administration has their own home modification specialists that do virtual and physical assessments, and they provide all the funding. So I'm not involved when it comes to a veteran. All my clients have been non-veterans. 4 families have opted to structurally change their home, 2 with a complete bathroom renovation where they've gutted the bathroom and started over, and 2 added new wings. So the majority of my folks have done temporary modifications simply because of the financial aspect of making these structural changes. 34 of my families have added some type of ramping, and 20 have added bidets. And as I mentioned, it is the most number one device that I get feedback on. And I encourage anybody listening to this presentation, please talk about bidets. It's such a quality of life issue. And they have bidets now with remote control. So if you have somebody with ALS that's having hand difficulty, you can put the remote control on the floor, and if they can use their foot, they can activate the remote control that way. Or you can have the caregiver hold the remote control. So I have one family who swears by their bidet, and the individual with ALS doesn't have arm function, but he can still speak. So he will be in the bathroom, and when he's ready, he will tell his wife, okay, hit the water. She hits the water. He tells her when to hit the dryer and when to hit the sanitizer. You could even use your speech generating device to do the same thing. So there are ways to use bidets, even if the client with ALS can't physically activate the bidet. So our virtual visits in the Greater Philadelphia chapter have been positive outcomes for all of us, especially for me, less wear and tear on my car, much more convenient for me. Yes, not being there physically, it presents a challenge, but I think the COVID-19 pandemic has taught us all that things can be done now virtually, and we've adapted and modified. This is my chapter's service area. So we cover Eastern Pennsylvania, Central and Southern New Jersey, and all of Delaware. So inevitably, me staying home and doing virtual visits has allowed me to reach many more families than I ever would have been able to driving my vehicle. And it's also saving the chapter money. So for example, I'm over here in this county in the pink, and for me to go to Harrisburg, which is around right here, that's the state capital, 220 miles and 2 hours each way, 4 hours, almost a day in the car. So I saved the chapter $126 just in reimbursement. If I'm going from my little town in Hatfield all the way to the lower Delaware where we serve, 308 miles and 3 or more hours each way. And then Wellsboro, that's up in Tioga County up here, 406 miles round trip, 5 hours or more each way. So I couldn't have served people like that before. The chapter couldn't afford me to be on the road all day just to see one patient. So we have been able to service many more people than we ever thought we were able to. And it's been so positive, not just for myself, but also for our families. And it has enabled the chapter to offer a program that was limited in scope before, simply because, I could only do about a 2-hour travel time from my home. Now I can go within the chapter's whole service area. And I know many other people listening from various chapters, they cover 3-4 states. So you can offer this virtual service to the most rural reaching clients as long as they can have access to a cell phone. So education and outcome is so important to our clients with ALS. It's imperative for us as clinicians and therapists to talk about the home environment and talk about safety, comfort, but also greater independence and quality of life. The most important thing I could say is please tell families that modifying a home does not always require breaking down walls or adding an extension on their home. There are many assistive technology devices that can be used in the home to make it safe, accessible, and to improve a client's quality of life. And these devices do not require structural changes and are temporary, so that when the client's done with them, they can easily be removed. Some of them are pretty inexpensive, and some of them cost a few $1,000s. That's up to the family of how much they want to spend. But there are a wide range of products in a different financial areas that can give a solution to a client and their family. So it's important as allied healthcare professionals that we understand the disease process, the average lifespan, and recognize that assistive technology devices can supplement expensive and time-consuming structural changes. What we want to do is help people identify their needs and give them guidance about the approximate cost of the modifications we're recommending. And I had a lovely conversation with a client of mine recently, and he was, as his statement here was, he was very apprehensive about meeting with me virtually because he's like, I'm not tech savvy. So I sent him a Zoom link, and he pressed the Zoom link, and the first thing he said is, there you are. And I'm like, yes, here I am. We're very good. You did it together. And one of the things that I felt I achieved with him was knowing that he didn't have to wipe out his savings because he wanted the savings to go to his wife. So knowing that he didn't, because his expectation was, I'm going to have to add on something, I'm going to have to add on a room or gut my bathroom. And we talked about all the different ways that we could make the home accessible to him. And he was delighted to hear that. So these are the references. These are the references of the articles that I used. And please reach out to me on email, find me on social media. I am happy to share the knowledge about this program and the parameters and guidelines. We do have written guidelines about the program that I'm willing to share. So I want to thank you for your time, and I appreciate this opportunity to speak with you today. Bye-bye.
Thank you so much, Alisa. That's really a fantastic program, and really just great the way that you've modified that to change on our changing times. And there have been a lot of questions about, is this available then in other areas of the United States? Like, are other chapters doing it? Are other people doing it? There were some questions about facing barriers when you go into the home. We don't have a lot of time, but I would like you to have the opportunity to speak to a few of these. And then, Alisa, I know you're very tech savvy. Would you mind going into the chat box then and answering some?
Sure.
Later?
I've been trying to answer some of them, yes.
Okay.
One of the things I wanted to follow up with before this presentation started, I put a document in the chat box from my colleague, Antoinette Verdone. I was chatting with Antoinette over the weekend about documentation for home modifications, and she had sent me this document, and she's like, you're free to use it as long as you accredit it to my company. And I asked her tonight, right before I came on, I'm like, can I tell people about this? And she said, sure. So it's a great document. I wish there were more apps out there, but we make do with what we can. So you are free to use Antoinette's document as long as credit is given to her.
All right.
Yes, I can repost that document, Meg. Oh, I'm sorry, Sarah, I'm doing your job. I was told that.
I think we work very well together, Lisa. I don't think it's a problem. All right, so everyone join with me in thanking Alisa, and again, go ahead and answer your questions in the chat.
Okay, I will. Thanks.